Good morning, I am Gabrielle Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of positioning and draping of a patient. It is important to minimize the injury in the patient. So, good morning, ma'am. I am your nurse for today. What is your name?
I am Mahalin Africa.
Is it okay with you if I'm going to touch your body that is needed in this examination?
Yes.
So, before that, we need to perform hand washing to prevent viruses to spread and provide class privacy like closing the doors and curtains. First one is the standing position. I already examined the examination bed of the patient and now I will assist my patient to stand with her slippers. And then after that, in terms of vaginal examination, I will elevate 1 foot of my patient in a low stool and separate them as she is comfortable. By this position, you can examine the posture, balance, and gait as well as female genitalia. And for her drapings and the gown, it is important to untie the back gown and leave the uppermost. The next is the sitting position where you can elevate the head, neck, lungs, chest, and upper extremities of a patient. I already adjust the examination bed of my patient. I will now assist my patient to sit firmly on the bed. As you can see, her feet cannot reach the floor, so I provide the footrest for her knees to bend. I also prefer a gown to cover her body and a draping sheet to cover the waist and her legs. This position is you can examine the upper extremities of the patient. The third is the supine position where it allows the abdominal muscles to stretch and easy access to peripheral pulses. I already adjust the examination bed of the patient. Now I will assist my client to lie her back at the bed with her legs stretched or slightly flexed. I will place one pillow below the head and below her knees. After that, I will place her arms crossed at the chest, above the side of the head, then side of her body. After that, I will use the draping sheet to cover from neck to legs. And that's all for supine position. Next is the dorsal recumbent position. It is like the supine position where you can assess the head, neck, lungs, chest, and upper extremities of the patient. And it is also easy access to peripheral palsy. And if your patient have back pain, this position will be comfortable with them. First one is I already adjusted the examination bed of the patient. Now I will assist my patient to lie back at her bed. After that, I will flex her legs and separate it and let the soles of the feet touch the bed flatly. Then I will place the hands or arms crossed at the chest. Place one pillow below the head. After that, I will push the flex legs to the edge of the bed. Then I will use the drapings to cover her legs. Then wrap the drapings both sides of the legs. Then the folded drapings over the chest. After that, this below the drapings, I will open it if the doctor is ready. Next one is the dorsal litotomy position where you can assess and examine the female genitalia or reproductive organ or rectum. It is always important that you assemble all the equipment needed. First is I will assess my patient to lie back at her bed. And then I will insert the leg stockinets and adjust the stirrups. I will separate her legs and flex her thigh towards the abdomen. After that, I'm going to drone back her buttocks to the edge of the bed. And then, I will assist my patient to raise her hand above the head and use draping sheet to cover the legs. And it is important to use the lithotomic tape. Next one is the Sims position where you can also assess and examine the female genitalia, reproductive organ, or rectum. It is important that you always assemble the equipment needed. First, I will assess my client to lie back on the left side with legs flexed and body inclined forward. After that, I will assess her arms behind her back, then drone her knee higher than the other knee. Then I will use the draping sheet to cover her legs. That's all for Sims position. Next one is the prone position where you can assess and examine the hip joint and back of the patient. First, I will assist my patient in a supine position. After that, I will assist to turn over her body into the abdomen. After that, turn her head onto one side. Then let her hands put in on both sides of her head. Then using the draping sheet, I will cover her legs. That's all for prone position. Next is the foiler position where you can provide and promote oxygenation. But it is important that you assemble all the equipment needed. First, I will assist my patient with the horizontal recumbent position. Then after that, I will elevate her bed at approximately 45 degrees. After that, I will slightly flex her legs and support it with pillow. After that, I will using the draping sheet to cover her body. That is for spoiler. Next is the tender and bridge position or the T position, where the body is laid flatly on the back and feet is elevated 15 to 30 degrees above the head and shoulders. It is where when the patient is hypotension to bring back all the normal blood pressure. It is important to assemble all the equipment needed. But before that, I will assess my patient in a supine position. Then after that, I will elevate her foot 15 to 30 degrees above her head and shoulders. It is important that you need to have support in her shoulders and knees. After that, I will use the draping sheet to cover the body. This is the Tenderin Verge or T position. Next one is the knee chest position where you can assess and examine the rectum of the patient. It is important to assemble all the equipment needed. First, I will assist my client to a prone position. Then after that, assist her knees to bend and separate slightly. After that, I will assist her head to turn on one side and her arms on both sides. I will use the draping sheet to cover the lower part. Done with the 10 different positions and draping, it is important to perform again hand washing to prevent virus to spread. I am Gabrielle Baliton, BS in Nursing on San Pablo Colleges. Thank you.